The commercial begins with showing a married couple that's in an airport and is narrated by the wife. She says her husband has been diagnosed with Alzheimer's disease and they wanted to wait to see how he did. But then their grandchildren approach them and the husband does not recognize them and looks confused. The wife states, "That's when I knew I had to do something." It then shows the couple in the doctor's office, and the wife says they talked to their doctor and he informed them that prescription Aricept is the only treatment approved for all stages of Alzheimer's. The wife says, "We started Carl on it right away." At the bottom of the screen, it states individuals' results may vary and that Aricept is tolerated well but not for everyone. Those who are at risk for stomach ulcers or take various meds should tell their doctor, because serious stomach problems like bleeding may get worse, and some may experience fainting, nausea, vomiting, diarrhea, bruising, and insomnia. While the voiceover on the commercial is talking about the potential risks, it shows the couple together looking through photo albums, remembering things together. At the end of the commercial, the wife says, "I'm so happy we acted when we did." My personal view of the commercial is that the couple has hope that Aricept is the answer to the uncertain questions that come with Alzheimer's disease. The product insert for Aricept states that Aricept is for the treatment of dementia with Alzheimer's. The efficacy has been demonstrated with mild, moderate, and severe stages of Alzheimer's disease. It says Aricept should be taken at night and can be taken with or without food. Pills should not be crushed or split, and the product insert contains the same common adverse side effects as the commercial. These include chest pain, toothache, fecal incontinence, GI bleed, bradycardia, dehydration, bone fracture, delusions, tremors, blurred vision, sore throat, and urinary incontinence. Potential drug interactions include cholinesterase inhibitors, and it also states that caution is advised with many other medications as well. Aricept comes in two forms. One is an orally disintegrating tablet, and the other is a film-coated tablet. The orally disintegrating tablet is quite a bit more expensive, and it costs around $250. The patient dissolves the tablet on their tongue and then swallows it. The film-coated tablet is a lot more reasonable, and it costs approximately $30. If a patient of mine requested this medication, I would first obtain a thorough medical history, and this would include a list of all routine medications that the patient takes. This would help me to determine if Aricept is an appropriate medication for that particular patient. My view of pharmaceutical advertisements is that if they are regulated correctly, as the FDA has started to do, they could be a very useful tool for patients and providers. As a provider, it's my job to inform the patient on whether a medication is appropriate for them, but I believe pharmaceutical commercials can help open up the lines of communication between providers and patients.